I am Dr. Matthew Marano. Today I'm going to be talking about Durysta. It's an injectable medication for the treatment of glaucoma. I am Chief of Ophthalmology at St. Barnabas Medical Center in Livingston, New Jersey, and St. Michael's Medical Center, as well as Chief Medical Editor of Ophthalmology 360. What is Durysta? It is a sustained release bimatoprose placed in the anterior chamber angle. It's essentially Lumigan as a sustained release medication. After the injection, it sits inferiorly around the 6 o'clock position and stays there. Currently is approved for one-time injection by the FDA. When do we use Durysta? Durysta is used for individuals who have glaucoma with an open angle. Patients can be treated with SLT or various medications. There's no real paradigm or plan on how to use Durysta, but in my practice, we generally have used it in the pseudophakics predominantly. Often they've had a MIGS procedure or another glaucoma procedure and or SLT. Durysta is a perfect medication to follow up with those medications for individuals who either have uncontrolled glaucoma or who are non-compliant. It is approved by Medicare and some commercial insurances. It can be injected either at the slit lamp or at the operating microscope, depending upon the surgeon's preference. Reimbursement for the medication varies by location, state by state. In our practice, we carefully explain the benefits of placing the sustained release medication in the angle of the eye to not just the patient, but quite often a family member. We often say that you'll have less dependence upon the medication, as well as you're going to get a better control of a continuous infusion of the medication in the anterior chamber. We discuss cost, compliance, and any other personal problems or questions the patient may have. What technique? Our experience in our office has been that it works extremely well in the slit lamp. It can take, after a small learning curve, sometimes 15 seconds to actually inject the medication, get the patient set up at the slit lamp. They're very comfortable, and you just tell them to relax. Everything's going to go very smoothly. I will have a technician hold the upper lid, as well as while I'm talking to the patient, I will give the patient proparacaine and a betadine drop or wash. You can use a betadine swab as well if you choose. It's injected generally temporally. However, I have some patients, particularly if you're very right-handed dominant or left-handed dominant, you can do a nasal approach. Some patients are moving around a lot. Some of them are looking not straight ahead. They may not be able to see out of the other eye, so they can't really focus. So sometimes I will change and just say, okay, we'll do this nasally with counter pressure, either with a Q-tip, or sometimes you can even use your finger on the under lid to do counter pressure. Most patients are very satisfied with how smooth the whole procedure goes. They often thank us for doing it that very day. They're surprised. As you know, anyone that walks in to have a procedure or anyone with glaucoma is generally very terrified when they walk into the office because everyone thinks they may or and can go blind with glaucoma. Patient preparation, staff preparation, as long as the staff believes in the product and your procedure and your rationale, generally you'll do very, very well and the patients will be extremely happy. It biodegrades into carbon dioxide and water over a period of time. It actually looks like a little log when it first comes out, and you'll see it like a little snowball sitting around 6 o'clock after about 2 or 3 months. Most patients have a second Durysta in our practice about 2 weeks later. And I do follow them about 2 weeks after that, or 4 to 6 weeks. Initially, I'm letting them go a little bit longer. I don't let them go 3 months afterwards, just because I just want to make sure that everything is fine and that the pressure is good. The eyes, ocular surface disease is less in these individuals who are no longer putting preservative medication on the eye, which is involved in all glaucoma drops. Ultimately, these, as I said, the patients have less injection, the eyes look quieter, the patients are happier, they see better. I do a fairly large number of extended depth of focus patients or multifocal patients, and they're not chasing their eyes with Allrex and Restasis or Xiidra and the other medications. They're much, much happier. The eyes look whiter. They look much more comfortable. FDA study showed when they Allergan did it, patients had a 32% drop in pressure with the Durysta, very similar to what you would get with a Travatan, Lumigan, or maybe not quite as well with a latanoprost. The outcomes, as you know, glaucoma is a chronic disease. Compliance is very, very difficult for most patients. Probably 45% of the patients don't take all their medications properly. With COVID, we've had issues where patients couldn't come into the office, or they couldn't get refills, or some offices couldn't even be contacted because the answering services were too busy. Our patients are generally very gratified with the results. There's improved quality of ocular surface, improved quality of vision, and comfort. 27% of patients experience some hyperemia initially. I think that's often either from the betadine or from the proparacaine. But when they come back after their 2-week follow-up, the eyes are much, much whiter. Patients are happier, and they feel better, and even their family members think they look better.